Did you know that chlamydia is the most commonly reported sexually transmitted infection in the United States? Millions of cases each year, and here's what's even more concerning. Most women who have it, they don't even know they're infected. Hi, Dr. Peter Aziz. I'm a board-certified urogynecologist, pelvic surgeon. Today we're going to talk about everything you need to know about chlamydia infection. This is critical information that could protect your fertility, your health, and your future. So what is chlamydia? Let's start with the basics. Chlamydia is a bacterial infection. It's transmitted through sexual contact, including vaginal, oral, and anal sex. Here's what makes chlamydia particularly dangerous. It's what we call a silent infection. The majority of women who have chlamydia, they have no symptoms at all. You can feel completely fine and still be infected and potentially spreading it to others. So why does this matter? You might be thinking, if I don't have symptoms, why does it matter? This is where chlamydia becomes a serious health concern. Because if left untreated, chlamydia can cause significant damage to your reproductive system. It can lead to pelvic inflammatory disease, which is an infection of the uterus, fallopian tubes, ovaries. This can also result in chronic pelvic pain, infertility, and pregnancy outside of the uterus. In fact, chlamydia is one of the leading preventable causes of infertility in women. This is why early detection and treatment so important. So who's at risk? Anyone who's sexually active can get chlamydia, but certain groups are at a higher risk. So younger women, particularly those under the age of 25, they have the highest rates of infection. So if you're sexually active and under 25, you should be getting screened for chlamydia at least once a year. Your risk also increases if you have multiple sexual partners, new sexual partners, if you do not use condoms consistently, or if you have a history of other sexually transmitted infections. So what are the symptoms? Remember, most women have no symptoms at all, but when symptoms do occur, here's what you might experience. You might notice abnormal vaginal discharge. It can be yellow, it can have an unusual odor. Some women experience burning or pain when urinating. You might have pain with intercourse, which we call dyspareunia. Pelvic pain, lower abdominal pain, especially if the infection starts spreading. Some women also experience bleeding between periods or after sex. These women can be subtle and easy to dismiss, which is why regular screening is so important. How do we test for chlamydia? It's very easy to diagnose it. A super simple test, straightforward. Most commonly is a urine sample. You provide urine specimen and the lab can detect the bacteria. Alternatively, you can get a swab, but this has to be done at the doctor's office during a pelvic exam. The test is highly accurate and results come back within a few days. So if you're sexually active, screening should be part of your routine healthcare. Again, especially if you're under the age of 25 with risk factors. So here's the good news, the treatment. It's completely curable with antibiotics to treat chlamydia. The standard treatment course of antibiotic, you can either take a single dose of azithromycin or you can also take doxycycline. They both highly effective when taken as prescribed. Absolutely critical that you complete the entire course of antibiotics. Even if you start feeling better, you need to finish all of the medication to ensure that the infection is completely cleared. Now, this is important. During the treatment, you must abstain from sexual activity for at least 7 days after you complete your medication. And this prevents reinfection and protects your partner. And this brings us to an important point about partner notification. If you test positive for chlamydia, all of your recent sexual partners, they need to be notified and tested. This typically means anyone you've had sexual contact with in the past 60 days. Your partner needs to be treated even if they tested negative or don't have symptoms. This is called expedited partner therapy, and it's essential to prevent you from getting reinfected. Many people, they feel embarrassed about notifying their partners, but remember, this is about your health, not judgment. Your healthcare provider can help you with this process and in some cases can provide treatment for your partners as well without them needing to come in for an appointment. So what are the complications of untreated chlamydia? Let's discuss what happens because this is where things start to get serious and a little bit dangerous. The most significant complication is pelvic inflammatory disease or PID. This occurs when the infection spreads from the cervix to the upper reproductive organs. It can cause permanent damage to your fallopian tubes, which can lead to infertility. Untreated chlamydia can increase your risk of ectopic pregnancy, and this is where pregnancy develops outside of the uterus, usually in the fallopian tubes. This is a life-threatening condition that requires immediate medical attention. Chronic pelvic pain can also develop, affecting your quality of life. You can also develop scarring, adhesions in the pelvis, which can cause ongoing problems as well. If you're pregnant and you have untreated chlamydia, you can pass the infection to your baby during delivery, potentially causing eye infections or lung infections in the newborn. So now let's talk about prevention strategies. Prevention is always better than treatment. Let's talk about how you protect yourself. The most effective prevention method is consistent and correct condom use. Condoms significantly reduce your risk of chlamydia and other sexually transmitted infections when used properly every time you have sex. Also, limiting your sexual partners can reduce your risk. Being in a mutually monogamous relationships with a partner who has tested negative for STIs is the safest approach. Get tested regularly if you're sexually active, under 25. Annual screening is recommended. However, if you have multiple sexual partners or other risk factors, you might need frequent testing, like every 3 to 6 months. So let's talk about something that many people don't realize. Having chlamydia once doesn't protect you from getting it again. In fact, reinfection is very common, especially if partners aren't treated for it, and you're exposed to new partners. Each time you get chlamydia, your risk of complications increase. This is why partner treatment is so important and why you need to be retested 3 months after completing treatment. Research have shown that many people who are treated for chlamydia test positive again within few months, usually because of reinfection from an untreated partner. Just remember, chlamydia is incredibly common, but it's also preventable and completely treatable. The key is awareness, regular testing, and prompt treatment when needed. Don't let embarrassment or fear keep you from getting tested. Taking care of your sexual health is just as important as any other aspect of your health. Early detection can prevent serious complications and protect your fertility. If you found this information helpful, please subscribe to my channel for more evidence-based content about pelvic health, urology, healthy lifestyle. Leave questions in the comment below. Please like and subscribe. Your health is worth protecting. I'm Dr. Peter Aziz, and I'll see you guys in the next video.